Hello, everyone. I'm Brian Zimmerman with Becker's Healthcare. Thank you for tuning into the Becker's Healthcare podcast series. Today, I'm pleased to be joined by Tammie Jackson, Chief Growth Officer with FinThrive, for a discussion on health equity and social determinants of health. Tammie, thanks so much for taking the time to speak with me today.
Oh, thank you for having me. Pleasure to be here.
Yep, very, very important topic. So let's dig in here. And, a person's state of health is, of course, largely based on the environment in which they're born, grow, live, work, age. Can you talk a little bit about social determinants of health and how specific socioeconomic attributes can lead to some of the health disparities that are so pervasive in our healthcare system?
Yeah, sure. And thank you for the question. It is an incredibly important topic. So, much of our overall health is impacted by various socioeconomic factors, which don't involve ever stepping foot into a doctor's office, clinic, or hospital. Research indicates that as much as 80% of these factors determine the quality of our lives, and make no bones about it, it also affects the quantity of our lives. And that's an incredibly significant number, 80% that is. Social determinants of health, so commonly referred to as SDOH, they include various factors of which economic stability is one. So people managing economic instability, they struggle to acquire things like healthy food, transportation, or safe housing, and this can influence their health outcomes. So, for example, without reliable public or personal transportation, people may skip an annual checkup, their follow-up visit, or recommended screenings and/or trips to the pharmacy to refill prescriptions. Or they may simply forego a treatment for a common condition until it gets to be severe. And so in each of those circumstances, I think you can see how these barriers to care can often lead to bigger, more costly healthcare issues down the line. Next, having positive relationships at home, school, work, and in your community, that too has a major impact on your health and well-being. These relationships can significantly influence overall physical and mental health. Access to quality education, that correlates to health and longevity. More frequently, students who do well in school, they see positive long-term health benefits. Finally, the environment in which we reside and work, that too influences our health outcomes. So people who live in areas with high rates of violence, unsafe air or water, or other health and safety risks, they often have worse health outcomes than those who do not.
Thank you, Tammie, for that. And of course, as we know, the studies on social determinants of health have just really shown the breadth of this challenge that has plagued marginalized groups in this country for a very long time, obviously. Then COVID-19 comes around, right? And sort of targets some of these disparities and makes these inequities even worse in this really insidious way. So can you talk a bit more about how COVID-19 has really made health inequity, just risen it to the level of prominence in leaders' psyches right now in terms of what they're prioritizing?
Yeah, no, I think that's a really good, important thing to underscore. And so in addition to my role as Chief Growth Officer at FinThrive, I also have the pleasure and the honor of serving as National Chair for Healthcare Financial Management Association, that's HFMA. And I've made this very topic really cornerstone to my year as chair and my theme. And so back at our annual conference in November of 2021, I spoke about, building a future that's bolder, brighter, and better. And historically, we have seen, massive disparities in disease prevalence, mortality rates, and access to care among marginalized groups in our society. And this has been going on for decades. So the risks as a result of SDOH factors, right, they manifest themselves inequitably amongst some racial and ethnic minority groups, making it difficult for those individuals to be as healthy as possible. And I would also say that holds true for any marginalized cohort, right? So it's important that we make that clear. It's not simply about racial and ethnic minority groups, it's marginalized cohorts. The COVID-19 pandemic didn't create these inequities. That has long been part of our before narrative. It revealed it in a very meaningful way, and it further exacerbated the need to address these entrenched inequities in order to improve health for all. So if you look at 2020, for example, just really focusing on how COVID-19 manifested itself in these inequitable ways, we look at the marginalized groups of American Indian, Alaskan Native, Black, Hispanic, Native Hawaiian. and other Pacific Islander people. In 2020, those groups disproportionately died from COVID-19. Those groups had 3 times the premature excess death rate than did white and Asian Americans. And my argument is that we just kind of, once you know it, once you see it, you can't unsee it, you can't unknow it. And so we should not accept that social determinants of health can manifest themselves in such inequitable ways. And it's not simply about creating more access to testing and vaccinations, although that's certainly part of it. It's understanding how socioeconomic attributes manifest themselves. And with this knowledge, we can better intervene in meaningful ways, large-scale interventions to address the holistic health and wellness needs of the communities that we all live in and serve.
Really important points there, Tammie. And of course, there's now broad consensus sort of on the importance of improving health for these marginalized cohorts, as you rightly described them. There's probably also a real risk of sort of a lot of this consensus just turning up as lip service, right? A lot of talk and maybe not as much action behind it. So I think an important question is, what actionable strategies can healthcare professionals take to really make a difference here? Can you talk about that?
You're absolutely right. I know one thing that's been important to me is that as I leverage the platform that I have as chair, I want to talk about something that I'm incredibly passionate about. And I want to, continue to look forward to ways that explore how we encourage greater diversity in healthcare to ensure the industry mirrors its patient populations. And that's critically important to achieving a culturally competent healthcare system. So promoting health equity, right? That's what we're all talking about. It's giving people the equal opportunity to be healthy. It's just and it's a worthy cause. And each of our healthcare colleagues can and should work towards breaking down barriers. And so when we talk about what can we each do, it is designing a revenue cycle strategy that can be executed equitably across all demographic groups. It is creating an accessible digital front door strategy that makes healthcare more financially attainable. It is designing a telehealth practice that is accessible by all, regardless of their socioeconomic, sociodemographic status. We can all play a role. And even if you're not the one that's building the strategies or writing policies or purchasing assets, even if you are the one that may be even selling into these industries, you become a critical filter to help call out the inequities so that they can be addressed. Again, taking on that position that once you see it or you know it, you can't unsee it or unknow it. And so small steps can make a big difference if we're well informed and if we're well educated and if we are well intentioned. Our future, in my mind, looks a lot brighter.
Yeah, and I really appreciate you sharing some of these examples about, like, as you mentioned, sort of creating these new strategies, building these different platforms, writing these various policies. And of course, all of this requires investment, right? So can we dig in a little bit more here? Can you talk about how healthcare organizations have really begun to invest in social interventions to drive this very important change through innovation and really achieve more equity?
Yeah, I'd love to, because I think, first and foremost, I think it's important that we share these stories of success because it encourages us all to stay the course, right? So many healthcare organizations are already using socioeconomic data to drive measurable change and successful interventions. So I'm going to give you a few examples. So there is an integrated delivery system in Ohio, and they have identified individuals with an elevated financial risk within their patient and their member populations. So these individuals were enrolled in a financial opportunity center, and they get support, counseling, job training, and coaching. Since implementing those intervention strategies, that population has shown measurable impact in reducing emergency room visits, inpatient utilization. They've had an increase in primary care utilization. And in addition, they're seeing steadier monthly income and enhanced credit scores. So we're talking about meaningful long-term results when somebody feels, financially empowered, financially resilient. Another example is a produce prescription program in Ward 8 of Washington, D.C. They brought a diversified team together to improve the health for pre-diabetic, diabetic, and hypertensive individuals who faced food insecurity. And in that case, the driver was, access and affordability. So the program provides a $20 per week prescription for fruits and vegetables, as well as a nutritional consult. And they've seen incredible results, such as, again, a decrease in ED visits and hospitalizations, an increase in primary care. All of that has already been seen. Another example I'll give you is a Medicaid managed care organization also in Washington, D.C., and they recently partnered with community organizations to provide patients who are facing housing instability. And they provided them with a safe and supportive place to heal after a hospital discharge. So they did the work to understand that it was a small window of time when they left the hospital where they had the most difficulty. So the ultimate goal of the program is to secure permanent housing for their residents and lower hospital readmission rates among its patient population, and they're having incredible results. So it's a collaborative model. It's provide measurable impact and a high likelihood of success, enabling everybody to win. So looking towards the future, right? So automation in healthcare, it should lower the cost of care, and it should help break down barriers, making healthcare more accessible to all. Rural patients should have access to quality care and specialists. Rural patients are also a marginalized group. Patients without access to reliable transportation shouldn't miss follow-up appointments. Minority patients shouldn't have worse health outcomes because they are managing some of the implicit biases that we deal with in our healthcare system.
Tammie, thank you so much for sharing those. I think it's so important to hear concrete examples like this and be able to think about and understand that there are patients that are real people on the end of these benefits. And I think it really illustrates just how impactful, really thinking about and focusing on social determinants itself can be, what a positive impact it can be on our health system. But I want to close here by just asking, perhaps organizations who really haven't gotten the ball rolling here, how should they start? And if they have gotten the ball rolling or they're already doing some work, how should they really, elevate their efforts and continue on this path?
Yeah, no, and that's a lot of people are trying to figure that out, right? How do I get started? I think what is not disputed and not in question is that there's no doubt that addressing individual and community needs, whether it be related to housing or transportation, employment, food insecurity, and or social isolation, it can really enhance prevention and treatment strategies, improve overall wellness, and mitigate risk. So for organizations that are starting to build out intervention programs and use SDOH data, I'd recommend, let's say, a few things to foster more successful approaches. So the first, it's important to utilize reliable, varied data sources to assess and visualize social risk among individuals and the populations that you serve. And that goes, of course, beyond just clinical and claims data. And it's important that you understand the social risks that are prevalent within the communities, even if those individuals aren't your patients. The community risk is important to understand. Second, once the data is compiled, you'll need to determine which socio-clinical interventions make the most sense for your patients, your community, and your organizations. And so you have to consider what partnerships may be available, which programs may be deployed more effectively and efficiently, and any existing strategies that you already have in place that you could augment. These large-scale interventions really do take, social resources, community assets. And lastly, keep a close eye on the impact. Track the ROI and the key business metrics from these intervention programs and continue to review and learn from the intel. With social determinant of health data, health systems can look beyond health outcomes and leverage a roots approach to improve life outcomes and trajectories. So health organizations, they often start with pilot programs to establish proof points with the fundamental goal of making these programs scalable and sustainable over the long term. Broadly, the objective is to reduce the total cost of care while improving health outcomes. Organizations that have implemented SDOH programs at scale, they have seen considerable ROI, including significant reductions in emergency department visits and readmissions. So we all recognize the power of socioeconomic data, in addition, again, to clinical and claims data to better identify and close the gap on health disparities. It's just a matter of taking that first step and really identifying how we can use this information in an actionable and scalable way to ultimately enrich care and enact change.
Tammie, thank you so much. I just really want to say I appreciate you coming on and sharing insights with our listeners that folks out there can really take and act on. So very much appreciated.
Oh, thank you. I enjoyed the conversation. I think we have to keep this going.
Absolutely. The conversation needs to be one that perpetuates, for a very long time. So thank you so much. I also want to thank our podcast sponsor, FinThrive. You can tune into more podcasts from Becker's Healthcare by visiting our podcast page at beckershospitalreview.com/podcasts.